There was a time when plastic surgery was only for the rich and famous. Now it seems everyone is taking advantage of minimally invasive procedures to look and feel better.
In fact, Dr. Robert Patterson, a board-certified plastic surgeon in Hamilton, is going to be the first in Canada to perform a plastic surgery procedure live on Facebook. Using a digital camera and an extra person in the treatment room, he will perform a minimally invasive lunchtime procedure that has instant results. And anyone on Facebook will be able to watch.
Dr. Robert Patterson joins us now here in our studios. Doctor, is Botox now the most performed cosmetic treatment in Canada?
Botox, thank you, Mark and Donna. Botox certainly is an extremely popular procedure.
And how did it become so popular? And can virtually any person afford a Botox treatment, or are they out of the range for some people?
Like any procedure, it's not for everybody, but Botox is simple and very effective for a large number of conditions and a large number of people. It's so simple and easy, it can easily be done on a lunchtime break from work.
Now, you're talking about lunchtime and Facebook and the fact that you're going to be performing this surgery. What exactly will you be doing?
So we'll have a real live patient. We'll show some pictures beforehand. We'll show some pictures as she's having her injections, show just how simple it is, and show afterwards.
So is it a Botox injection?
It'll be a Botox injection. The results of the injection won't be apparent immediately because Botox usually takes 24 to 48 hours to have its effect.
Does everybody benefit from Botox? Because I've heard that there are some complications that could arise if you have Botox.
The beauty of Botox is extremely safe when used properly. Like any kind of medication or drug, a certain amount of dose might not be effective for some people. They might require larger amounts. And for some conditions, obviously, other treatments would be either more effective or less costly.
I'm seeing more and more women my age that are actually opting for fillers. And while it can take years off, I think when it's overdone in Botox, we probably all know someone who uses far too much Botox, and sometimes the injections really distort the face. Is there ever a time when you say to patients, men or women, whoa, you're getting, it's a little too much, or this isn't going to look good?
I think we all remember the movie with Goldie Hawn having her lips blown up and overdone. Certainly that doesn't look attractive to anybody. Most patients, fortunately, are very, very reasonable about their goals and their desires, and of course, with proper medical care, they're getting the right amounts of treatment.
Okay, so when you first have a consultation with a patient, do you explain to them that, here's the increments, you're going to have Botox every 4 months or 6 months or whatever it is, we're not going to change that, you'll look this way, and do your patients say, are they patient enough to say, okay, I can handle that, or do a lot of them, once they start seeing results, say, okay, I want to get better looking faster?
That's a good question, Mark, and it's a bit of both. I mean, the beauty of injectables, whether it be Botox or a filler, is the patient can assess their own results. So we do a treatment, a fairly conservative treatment initially. They get to see and appreciate the effects, and with the appropriate guidance, we'll see them back again, and if desirable, might augment a few other areas or do some fillers in addition to the Botox.
How effective, or first of all, how common is liposuction?
Liposuction remains one of the most common plastic surgery procedures.
And how effective is it? And long term, I mean permanently, if you go in for a liposuction treatment, is that it? You don't have to go back again?
It's not a cure-all. It's not an effective weight loss method, but it's extremely effective that people that have a balance in their diet and exercise, and then they have some problem areas that they can't otherwise address. It can offer very significant long-term benefits.
It's pretty invasive, though, isn't it?
Actually, it's one of the least invasive procedures that we do. We use typically a very, very tiny incision, and sometimes the incisions aren't even sutured.
Doctor, we're talking about the benefits here of different types of plastic or cosmetic surgery. What about some of the inherent risks?
And there is a careful discussion with all patients about risks. Again, the procedures so far, in particular, the injectables and liposuction, are the as I mentioned, fairly uninvasive procedures with very little risks. There are risks associated with an anesthetic and with any procedure, Careful patient selection and discussion of those risks is obviously an important part of that initial consultation.
But I'm not talking about those type of, not so much the health risks, but the risks to, what if your face or your body doesn't turn out the way you had hoped? What if there's bruising, that type of thing, which I've noticed in,
or paralysis,
with fillers. But the bruising, I think, more importantly, is a lot of, well, some women that I know, for example, have had the Botox or the filler treatment, and 3 or 4 days, even a week afterwards, they look like they had a treatment. There's bruising there, and it's uncomfortable for them.
That's certainly a possibility. Some patients will have, if they take aspirin or otherwise are prone to bleed easily, be at a higher risk. Certainly by using some ice afterwards can sometimes minimize that, but you're right, they do need to be prepared for it. As I mentioned earlier, the majority of people can do it quite easily on their lunchtime break, but probably the first time they have an injection, it's better to schedule it at a more convenient time where if they do incur a little bit of bruising or excessive swelling, that they're not going to be too embarrassed in their social situations.
What is a mini brow lift? I've heard that one.
Mini brow lift. There's many ways of doing brow lifts, and it'll be yet another variation on the theme. Exactly, it may be referring perhaps to an endoscopic brow lift where we use very small incisions. It may be referring to a lateral brow lift.
But what do you do?
And then there are other methods that we use, coming back to injectables, and simple methods of simply filling up some of the tissue just above the brow area to simulate the effects of a brow lift without actually undergoing a procedure.
Are people still getting full facelifts? I mean, with everything else available today, are people actually going under the knife and saying, suck it back?
Absolutely. It is wonderful, and medicine constantly evolves. We try to look for better and safer ways of doing things, less invasive methods. But there are limitations to all those procedures. There's lots of new technologies, lasers and radiofrequency technologies that can add to our armamentarium, but surgery still is a huge part, and there's things that can only be achieved with surgery, and it remains, actually, facelifts in particular are a very popular procedure, becoming more so. I think many people the last few years have maybe tried to avoid them and realize that some of those other procedures don't quite give them everything they want.
Okay, if you want to know about Dr. Patterson's Facebook fan page, we're going to throw it up here, and as we do, Doctor, one final question. Can you tell by looking at someone if they've had work done?
That's a good question. Most people want to go for a very natural look, so ideally if their surgery's done well, you won't be able to tell, but some do prefer a more artificial look.
I have a funny feeling you're really popular at a party.
Yeah. Well,
I could just see every woman I know saying, I want to know about this, I want to know about this.
We want to meet Dr. Patterson. Thanks so much. Good luck with this Facebook initiative and actually doing
and we'll be watching.
Surgeries or procedures online. Thanks so much, Dr. Robert Patterson.
Thank you, Mark and Donna. Thank you.
Well, the Mounties are investigating how 19 Greenpeace protesters in blue jumpsuits and white helmets were able to scale 2 buildings on Parliament Hill. Who cares how they did it? Just throw the book at them.
Donna, this was a legitimate and peaceful protest. Greenpeace should be commended, not condemned. Square Off is coming up next.